This is Truvada, aka PrEP. And when taken daily, it's up to 99% effective at preventing the contraction of HIV. PrEP has been used in HIV prevention since 2012, and since gay and bisexual men account for 83% of the estimated new HIV diagnoses among males 13 and older, it's changed the game for the LGBTQ community. But these little boys in blue are expensive, and at retail price, one pill costs about $59. Without insurance or financial assistance, Truvada can cost upwards of $1,700 for just a month's supply, but the people at Chicago House are helping others find a path to PrEP for next to nothing.
It's just not known how to navigate, which is why I have a job, of course.
Owen Davis is a PrEP navigator for Chicago House. He maps out a way to get PrEP in clients' hands regardless of barriers and says he's like a best friend, but with better information.
We know that condoms work really well if you use them like you're supposed to. We know that abstinence is cute. But we also know that we've had these things for a large amount of time. We know that HIV is still a present epidemic. So anything that we have in the arsenal to use against the fight and to use in the fight against HIV, we should use. And if it's someone who's just who has a number of barriers to where they can't even think about PrEP, I would address those barriers first.
Like cost. Gilead, the drug's manufacturer, does offer a copay card that covers up to $3,600. But if you're uninsured or underinsured, that may not be enough.
There are other foundations besides the Gilead copay card that can help you pay for your copays. So it's just a process, but it's a process that I'll be there with you.
But it's not always about the money. When someone asks their doctor for it, why would they be afraid to ask for it in the first place?
There's a lot of slut shaming attached to PrEP, and it bothers me so much.
You said you're sex positive here.
We're super sex positive. We don't care what you're doing. We just want to help you do it in a safe way.
The value of PrEP isn't always in writing the prescription. Sometimes there's a great conversation that happens about prevention and sexual health, and people really feeling empowered to sort of take on their own prevention story and message.
This is Kristen Keglevitz-Baker. Someone like Davis may navigate you to her. She's prescribed PrEP to thousands of people as chief operating officer and a physician's assistant at Howard Brown Health Center.
We have case managers who can help with a lot of the navigation of the healthcare system, insurance, copay. We have a pharmacy right on site at all of our locations where we're able to also get through the sort of barriers to treatment access.
What do you see for the future of PrEP?
I think that the Truvada, which is approved for PrEP now, will go generic in the next couple of years, and that's going to be a game changer in terms of affordability. I do think it's something that I hope that we'll be talking to people at a younger age so that they at least know, again, what's in the toolbox.
Critics of Truvada say the drug promotes unsafe practices and can be linked to a rise in STDs like gonorrhea, chlamydia, and syphilis, something PrEP doesn't protect you from.
Those are all treatable diseases, and although we don't want patients to necessarily have higher rising rates in the U.S. of those three, they're things that I can easily manage and treat and give and cure. And I think that if I still have benefit to preventing new HIV infections, which is chronic and doesn't have a cure, we still have benefit.
So what does it mean for those worried about HIV? Take it from Todrick Hall. They kind of feel like they took control of their sex life again?
They trust sex again. Honestly, they trust sex again. It's like they get this brand new feeling of, I am in control, I have it, I know what I'm doing.
Where would you like to see the future of PrEP go?
I just want better access. I want cheaper access, I want easier access, and I want more positive access.